This is a case of a unilocular cyst. This, I guess, is sort of like a companion case to the one that was
Yeah, it looks
presented
like my
earlier,
duplication cyst.
doesn't it? That's our theme of the day, I guess. So the patient went on to get an EUS, and it came back negative. So the clinical diagnosis, at least at the time that I read it, was just a benign cyst, and they thought it was probably a lymphangioma, our gastroenterologist. So unilocular pancreatic cyst, they're the most common cyst that's unilocular is pancreatic pseudocyst, but this patient doesn't have a history of pancreatitis. So then you think about IPMNs, and you can have unilocular serous cyst adenoma as well, and lymphoepithelial cyst. So in this case, it was felt to be lymphangioma. Um, but if the cyst, this one has a circumscribed border, but if it demonstrates lobular margin, apparently, though, you should, and it's in the head, then we should consider a unilocular macrocystic cyst adenoma, still benign. But if the wall is irregular, which is not in this case, then you want to think more aggressive. So cysts that are under 3 cm are almost always benign. And so at this institution, this was a paper published by Duchamp, they follow up at 6 months, 1, 2, and 3 years, and then after that, leave it alone if the patient's asymptomatic. Multiple cysts can occur with VHL, and in some cases, IPMN. My second case is,
Nelly, one thing
yes.
you don't have on your list there is just an MCN. So
Mm.
middle-aged female, like often they can just be unilocular and not necessarily have septations. In this case, this doesn't even look like it's like abutting the pancreas, but
Mm-hmm.
it doesn't really have like a cross sign with the pancreas. But
Mm-hmm.
body tail junction, like a rounded cyst, I would think about an MCN also.
Okay. Yeah, I mean, you're right. I mean, it doesn't look like it's arising from the pancreas, so it may just be, like, I'm not sure if they can tell by path a duplication cyst versus a pancreatic origin cyst. But yeah, MCN, that's a great thing to add to the list as well, in addition to duplication cyst, non-pancreatic cyst.
I'm
The
thinking
second
that
case,
I'm thinking that they probably can't diagnose a duplication cyst by EUS aspiration
mm-hmm.
because they need like the wall to show
Mm.
like the muscular coating and the epithelial lining.
So probably resection then in those cases.
Yeah.
After seeing your case, I almost want to recommend resection in this case.